disease, what are the common symptoms, how to diagnose this disease, and then what we can do to prevent this disease. First of all, I will tell what is the function of this kidney. We have two kidneys in our body, and basically this filter the waste product, the blood, and remove all the waste product, and this is diluted in the fluid which we say as a urine, and then all the waste product comes out. The normal function of this kidney is to remove this waste, and if we are taking any drug, to remove this drug and then balance the body fluid in our body, release some hormone which control the blood pressure and vitamin D in our body, and then production of blood cells, the red blood cells, so that we will have good oxygenation and no anemia. If you see, roughly 17% of the population in India is suffering from kidney disease, and most of these diseases are diagnosed in advanced stage. And so roughly around 150 to 230 person per million population is suffering from this disease. And most of the patients, as I have told, that they come to us in form of advanced renal failure. You know that this renal stage, the renal disease, is measured in different stages, stage 1 to stage 5. And if there is a renal failure, frank renal failure, we say it as a stage 5 disease. For diagnosing the renal failure, we usually ask the person to do a urine examination where we see the albumin-creatinine ratio. And if it is normal, then there is no risk. But if it is below the critical level, then yes, there is a higher than critical level, then yes, there is a risk of renal failure. And then we ask for the serum creatinine, which estimate the estimated GFR. If the GFR is more than 90 ml per hour, then that means that the patient kidney are very good. But if it is 60 to 90, then yes, there is a risk of developing renal failure. But if it is less than 60, then there is a definite renal failure, and these patients fall between stage 3 to stage 5, and they should meet their physician or the nephrologist so that this progression of disease in frank renal failure should not occur. The causes of renal failure most commonly are diabetes, hypertension, renal cystic disease, the infection, renal stone disease. So among these causes, you know that diabetes and the hypertension, blood pressure, are the foremost reasons, and which comprises around 40 to 60% of the renal failure. And you should know that these diabetes and hypertension are preventable disease. That means that if we do all the precaution to prevent the diabetes or hypertension, we will not develop the renal failure. And even if we have diagnosed with the diabetes or hypertension and we are taking a good control, the progression of this disease to the frank renal failure can be avoided. Once you are developing the renal failure, then you have only few options like dialysis. Dialysis can be hemodialysis or the peritoneal dialysis. In hemodialysis, we filter the blood in a specially designed machine called the dialysis machine, where in 2 to 3 hour session all the blood is circulated through this machine and the waste products are removed. Some patients where the blood pressure is very fluctuating, patient cannot go for the hemodialysis, then there is the option of peritoneal dialysis. Here a special fluid is put inside the peritoneal cavity and all the waste product is diluted in this and then comes out with the this fluid is taken out from a special catheter, and patient can be get rid of this waste product. But it's a very slow process and require long time, but this can be done at home and there is no need to visit the dialysis center. But the best option is the kidney transplantation, and whoever the person who is having eligible donor in the family and they are fit to undergo the transplantation is the best process where this renal failure can be overcome and patient will live with a normal or near normal. So in the last, I will tell you that what are the warning signs. Warning signs To develop the renal failure means where you should feel that there is a risk of developing the renal disease, kidney disease, that is the high blood pressure. If you have a high blood pressure, you should be very cautious. You should meet your physician or nephrologist so that this blood pressure can be controlled. The second thing, if you see blood in your urine, then it is also alarming. Third, if by any means on some urine examination you found that there is a protein in urine, that is again alarming sign for developing the renal failure. The fourth, if the creatinine is done and the estimated GFR is less than 60, that is again alarming sign. You may develop the renal failure or you are having renal failure. The last is if there is a decreased urine output or the swelling over the face or the feet, then this is also alarming sign and you should immediately meet with your physician or the nephrologist. So friends, I have narrated all the things about the kidney problem, what are the causes of the kidney disease, how you can diagnose yourself the kidney problem, and if there is a kidney disease diagnosed, then what are the things which you should take so that this kidney disease cannot be progressed to the renal failure and you need dialysis or any other thing. Thank you very much.